talk about the basics that you need to have on hand in case of an emergency with your horse. The first thing I'm going to start with is very simple. It is a thermometer. It is shocking how many people do not have a thermometer, and I ask them when they call what the horse's temperature is and they don't have one. So have one. Any kind of thermometer is fine. I prefer the digital ones because lots of people can't read the mercury ones so well, honestly, and I know when I use them I tend to break them. So that's step one. The major categories of emergencies you might have are probably wounds, eye problems, fevers, and colics. So let's start with what you would need for a wound, for basic wound care. Step one is something to clean out the wound with. Clean barn water, it's fine. Otherwise, having something on hand like a saline spray is good. And then some sort of a surgical scrub, either betadine. You'll then need something to bandage with. And I should also say, if something is bleeding heavily, don't try and clean it. You just want to put a pressure bandage. It's good to have a whole package of 4x4s like this. And then you'd want to take, if you need to put a pressure bandage on quickly, you want to take a very, very thick wad like this, or even thicker, and then put a layer on the outside that's going to snug up really tightly. Elasticon would be my choice because you can tighten it really easily. With vet wrap as a top layer. Vet wrap is much cheaper, so if it's in a place where the vet wrap will stay, that's fine. Here you need something to clean the wound with, something to make a pressure bandage, and something to make a regular unexciting bandage until your vet arrives. Just one more thing with wounds. If it is a wound that may possibly be sewable by a veterinarian, please do not put any topical medication on it until they have seen it, because some of those medications can be very difficult to get out and make it impossible to sew up the wound. Would be a colic, and really the thermometer is the main thing to have on hand, so when you call your vet and tell them what's going on, you're able to tell them what the temperature is. They may or may not instruct you to give Bandamine. That is at their discretion. And just be prepared to tell them what your horse's temperature is, if they've pooped, how they've eaten over the course of the day, and that's really what you need to have on hand. Eye emergency, you come in and find your horse's eyes swollen shut or they're squinting really hard. Again, there's not too much to have on hand for that. Sometimes, the one thing that's really important is sometimes people will have eye ointment sitting around the barn. It can be very dangerous to just put something in the horse's eye because you see a problem. If you have something like this, which has steroid in it, and you put that in a horse's eye that has a scrape, you could really cause a lot of damage. So it's much better to speak with your veterinarian or have them look at an eye before you put anything in it. And again, with eye pain, if you're waiting for them to come out, they may, again, instruct you to give Bandamine. So that's another case where it may be good to have the Bandamine on hand. Last type of emergency you might encounter is a sudden high fever. Again, the supplies you really need are your thermometer and possibly your bute or Bandamine, depending on what your vet would like you to do.